Okay, welcome everyone to the May 26th meeting of the Audit and Accountability Committee for Columbus City Schools. Madam Auditor, would you take the roll?
Chair Beckerly,
Here.
Vice Chair Vera,
Here.
Mr. Grant,
Here.
Mr. Vajon,
Here.
Ms. Reyes, Mr. Jordan,
Here.
and Mr. Daniel,
Here.
and you have a quorum.
Okay, thank you. Our first order of business is to approve the minutes from our last meeting. Do I have a motion?
So moved. Second.
Without objection, shall we approve the minutes? Any objections? No. Okay. And so now we're ready to item 1, the Office of Internal Audit Report. Madam Chair,
Thank you.
Auditor, I'll turn it over to you.
Okay. First up, instead of doing our normal report out, I'll take this off. Sound like
Yeah, it's hard.
muffled. Instead of doing our normal report out of status of outstanding issues, I've asked the Medicaid project team to present on the work that they have done as a result of two issues. The first was an analysis that I did a couple of years ago comparing the Columbus City Schools Medicaid reimbursements to similar-sized district, because I was trying to understand why our reimbursement was significantly less. I not do that on my own, so I asked some experts to join, and they put together a wonderful project team to really dig into that. And the second thing was there was a recommendation made during our audit of the district's revenue and receivables. Part of that audit raised a light on our county reimbursements. So the treasurer had contracted with a CPA firm to come in and actually look at those reimbursements to make sure that we weren't leaving anything on the table. And that report was presented to the FAC committee probably over a year ago. So with that, I felt it appropriate to have a report out on the Medicaid part of that audit come to the Audit and Accountability Committee, as that was kind of the catalyst for the incredible work. I can't overemphasize enough the incredible work and collaboration that was started. Initially, I was a member of that team, but my schedule became such that I could not consistently attend the meetings. So Mr. O'Connor served as the OIA rep, and with that, I will turn it over to Mr. O'Connor.
Thanks, Carolyn. First thing I would like to do is introduce my co-presenters. CCS Manager of Medicaid and Psychological Services, Dr. Robin Floyd, and Dan Thomas, who is President of HBS Incorporated, a vendor of the district. Thanks to both of them for all their work and effort to put such a great project together. We did send out an extensive document. We were intending to be a resource document, so I'm not going over the 64 pages today. I'm just going to go over the executive summary along with Dr. Floyd and Dan Thomas. And if you have questions, we'll be glad to take those at any time. Ryan, could you put up page 15 for us? As Ms. Smith said, the OIA project began in December 2017 when she asked why had another similar school district received more Medicaid reimbursements than CCS. And if you look at page 15, I know that's relatively small, but in fiscal year 2018, it was a $900,000 difference, while both districts, the first one on line 1 and line 2, had pretty much similar students with IEPs. I'll read those just because that is rather small. It was $5,023,496 for the Cleveland School District and $4,115,390 for our school district. The students for Cleveland were 8901 and 8986 for Columbus, and those are students with IEPs. So that's what kicked off this project. If you notice, if you look to fiscal year 2020, you'll see data for the same district had now increased to 1.7 million greater than Columbus City Schools. Even though Columbus City Schools now had 1,287 more students with IEPs. So that was the curious nature of this project, is why is that happening, and are there things we're not taking advantage of? Just what is causing this difference? So some of the actions taken by OIA staff were, we did a transportation audit that was issued in March 26th of 2019, and we noted that the transportation staff at that time was not utilizing Medicaid schools program for direct transportation services. That program started in 2015, and again, our audit work covered fiscal year 18.
What's the name of this program?
Medicaid schools program. It's known by the acronym MSP. So we did include a recommendation to have district staff explore utilizing this program to enhance Medicaid reimbursements for the district.
Is it reimbursement, or is it reimbursement and they actually transport too?
Well, it'd be based.
Or we will offload the cost then?
Dan, you want to take that one?
What was the question?
Medicaid schools program, is it just a reimbursement for transporting a certain category of students that are entitled to the payment, or are they actually doing the transporting?
So we would be doing the transport, I'm sorry, I
Okay.
jump in.
Yeah, that was.
And they have to have transportation recorded in their IEP to qualify and be
Okay.
eligible for that
I
reimbursement.
understand now, okay, thanks.
So that's the one. And then as Ms. Smith had talked about, a revenue audit that was issued January 23 of 2020. And this audit noted how decentralized the Medicaid eligible services revenue stream was across the district. So various staff throughout the district are responsible for compiling documents that are used for reimbursement claims. So currently, there's no one person responsible to examine what is causing documents that might be rejected, what's causing those items to be rejected, or to verify that these documents get corrected so CCS can get reimbursed for that work. Ryan, could you go to page 42, please? One document created by OIA as part of the revenue audit was a flow chart showing the process flow for the Medicaid process. So if you look at all the way on the left there, there's a lot of little people in there. That's just to signify the multiple streams that people have to complete this work. And without one person overseeing all this or being able to have the authority to make sure these people are completing these documents appropriately, it becomes difficult, and we might not be able to take advantage of all the eligible services that might just be missing a T being crossed or an I being dotted. So that's all that I wanted to just show the multitude of people involved in this. So basically, we came up with the objective of this project was for OIA to work with district staff from special education and student support to examine various processes and documents to maximize our Medicaid reimbursement potential within CCS offices and departments. We also were to evaluate how CCS reimbursements compare to other school districts and research other ways to enhance CCS reimbursements that can provide resources to design and implement things like whole child-focused staff development and trainings, additional services to build supportive relationships throughout the district. And next, Dr. Floyd will take us through some background information and go over some additional actions that have been taken. Dr. Floyd?
Thanks so much. Since schools are obligated to provide services to students with disabilities, they are also eligible to recoup some of the costs providing those specialized instructional services for those who qualify for an IEP. So beginning on page 8, we kind of gave a little bit of a background information, and then it continues with Columbus City Schools history and background. It's just extra reading for you, a little bit more detail that will dive in a little bit deeper. But our corresponding contact that we work with healthcare billing systems. That is their specialty. They understand all of the ins and outs, the federal and state regulations that have the eligibility status and the checks and balances for reimbursement.
Excuse me just for a second, I'm trying, should we close that door, or do you think it? Thanks, Dion. I just didn't want us to be distracted. I think somebody's
So the
happy.
background information in the Columbus City Schools history was more or less pulled together based on the inquiry that was made from the Office for Internal Audit to what extent are we leaving money on the table.
Yes, yes.
That's how it came to me in that way. So what we did was we compiled quarterly meetings, and beginning on page 47, and there are quite a few pages, it gives you a little bit of an overview of the agenda, the topics that we tackled, the team members that were a part of, there are people that came together from a cross-functional team of all areas that interface and overlap with school Medicaid in some way, shape, or form. So there it begins by showing you the cross-functional team members. It gives you a little bit of a highlight and more information about the transportation pilot that was recommended. And the reason I kind of highlight the transportation pilot is because at the time, when the Transportation Department was audited by the Office of Internal Audit, they found that we weren't doing any reimbursement for transportation services. And as Kevin mentioned, that became eligible in 2015, and we started this project in January of 2018. So we recommended that we focus on medically fragile students for reimbursement because they were on separate lift buses, and that way we knew for sure that they qualified for reimbursement for Medicaid. And just a little highlight and a teaser, that generated $250,000 in just 6 months. So the pilot was well worth the effort, and going through the checks and balances and developing logs to turn in. So far, everything is manual. So it was a lot of work, but $250,000 in just 6 months, half of a year, just from bringing everyone together was well worth the effort. So we also, from those quarterly meetings, began an outreach and began collaborating with the Franklin County Jobs and Family Services to see if we could develop a partnership to assist families with signing up for Medicaid insurance. As you know, families that have insurance receive medical benefits. When you think about the children in school, eyeglasses, hearing aids, assistive technology, also with our district being 100% free and reduced lunch, and families coming into the district that may be new to the country, we probably should be doing a better job with outreach and communication and helping them navigate that system. Well, the Franklin County Jobs and Family Services, they're willing to work with us. It's just a matter of being able to have some extended conversations to help families sign up for Medicaid insurance. That also supports the Whole Child Initiative for students being healthy and being ready for school. And also a great, tie-in is that it raises our eligibility rate for those families that are signed up for Medicaid on an annual basis that are regularly signed up and active, then that increases our eligibility rate as a district.
For eligibility for,
For reimbursement.
oh, the rate
It
increases
raises the
as our
percentage.
number of students that are, just,
Well, there's a lot of checks and balances that go hand in hand with being able to be reimbursed, but if they aren't signed up for Medicaid, after being on an individualized education plan, then we may not be able to recoup those expenses because they aren't signed up for Medicaid and they're not active in the system.
so, but the rate, improving our participation in Medicaid. Is that what you mean? Or it sounded like the rate might change the more students we have participating.
If you have, and I'll just kind of be in brief, and I'll defer to Dan because he's our specialist, but say, for instance, the Medicaid eligibility rate can be increased percentage-wise.
Right, that's what I
If they are signed up for Medicaid insurance. That goes hand in hand if there's a student that is eligible and qualifies for specialized education and is on an IEP. That's one qualifier. Another qualifier is whether or not there's signed parent consent. We could do everything right, but if they aren't active in Medicaid,
It's not gonna.
cross-reference, we won't be able to bill for it.
Okay. I mean, by way of confession, I was a special ed teacher, so I know, this is my world, so. And I'm married to a Medicaid geek, so I'm gonna
There you
be
go,
your worst
yeah.
nightmare of questioner.
School Medicaid has just a little twist to it, but it is very much connected.
Yeah, yeah,
So, yeah, we just haven't really taken a deep dive into looking at it because we have healthcare billing systems that really provides us a lot of information and insight, but we really push the envelope. To what extent are we leaving money on the table? So for me to be able to better understand and provide more guidance with the quarterly meetings, I volunteered to attend the NAME conference, and that is the National Alliance for Medicaid
In education.
in Education. And again, I wanted to better understand, to be a part of the conversation instead of depending on healthcare billing systems to share what needs to be done. I wanted to be a participant instead of a follower. So at that conference that I attended a couple of years ago before COVID shut everything down, I interfaced with Chicago Public Schools. Interestingly, Chicago Public Schools has a dedicated Medicaid department. They intertwine with all departments within their district, and their focus is health and wellness and making sure that all children that are eligible to sign up for Medicaid insurance do so in relation to SNAP. That raises their eligibility rate, that's one component, but they also have multiple layers and checks and balances to ensure that engagement takes place, to ensure that budget and finance is a part of the conversation, to ensure that other partners are at the table. So there's a bit of information there. The NAME conference, Chicago Public Schools, that can be found beginning on page 24, if you just want to kind of skim and look through that. So with the challenge that we had, as Kevin has already shared, we came up with process flow charts because oftentimes when we take on responsibilities, we do what has always been done. So we were challenging the status quo, so to say. So with that challenge and being audited by internal audit, they gave some good recommendations and asked a lot of questions about what are your metrics. I understood what metrics were, having a business background. However, I really had to ponder what were our metrics and checks and balances aside from the regular audits that take place with school Medicaid, aside from what we're doing at Columbus City Schools. So with that, Terry Addison and myself, Terry Addison is another CCS employee, decided to enroll in a Lean Six Sigma training project to really understand those risk factors, to answer the questions. There is an internal, a regular annual audit that takes place that's communicated with the Treasurer's Department that's called Agreed Upon Procedures. And with those agreed upon procedures, those are state and federal mandates, checks and balances of things that need to check out, and they do take a sample, but they also identify what the risks are. So Terry's goal, along with me, was to reduce our risk. So on Lean Six Sigma, that kind of begins on page 29, and you can really see the whole process that we went through. And in the end, with that whole process, we took Columbus City Schools School Medicaid on as our challenge and our project, and we did finish with our green belt. So it was well worth the effort. But all of us were pushed by this singular question: to what extent are we leaving money on the table? So that's pretty much where we are with that. There's a lot more information in this packet, but I most certainly have learned a lot more than just being a liaison to more or less share with HBS who they should contact for this particular audit or who they should be in contact with to receive information for checks and balances. Is there anything that I left out that?
Yes, you're a little too modest.
Yes.
In 2019, the AUP, which is Agreed Upon Procedures Audit, had noted 27 errors out of 74 items that were sampled. Through the work of Lean Six Sigma that Dr. Floyd and Terry Addison spearheaded, in the 2020 AUP audit, they found 2 errors out of 80. So that's the modesty sitting over there. So just so you know, the great work that they did, that can't go unannounced. So that's all I wanted to add. Thank you.
Thank you. So at this time, I'm going to turn this over to my partner here, Dan, with Healthcare Billing Systems.
Well, I want to explain a little bit about the methodology of the program, and then I want to discuss in a little more detail where we can increase the Medicaid reimbursement for.
Mr. Thomas, can I just interrupt for a minute, because I just want to make sure I understand. So just procedurally where we are. So we did this Six Sigma program, and did we come up with a recommendation? And that's what this program is? Is that what we're talking about? Like,
There was a recommendation at the end because we did combine with transportation and we took that on as a focus because of the pilot. Again, it brought together a nice cross-functional team to be able to plan and problem solve. But the recommendation obviously is if you don't have someone overseeing this,
okay, that's what,
it's going to be business as usual.
all right, and so enter,
Okay. So I want to talk a little bit about the methodology of the program, the reimbursement methodology, and then I'll discuss some ways that we, are leaving money on the table and some things we can do about that. So the first thing to understand is the Ohio Medicaid School Program, it reimburses school districts for the cost associated with providing those IEP medical services to students with Medicaid insurance. So once again, it's going to reimburse your district a portion of those costs associated with providing those medical services, not educational, but medical services to students who have Medicaid insurance. And when we talk about reimbursement of those costs we're referring to are salary and benefits of your employed therapist, and then contracted cost of therapist, your DD contracted cost. And to give you an example, for the 2020 school year, those therapy costs totaled a little over $24 million. So that's what we're starting out with, was $24 million worth of cost. And then we factor those down. And there's three cost factors that we factor these down in a cost report. We file at the end of the year a cost report. We say, here's how much Columbus paid for these services. And then we start factoring them down by, number one, the statewide random moment time study percentage. You'll hear it referred to as RMTS. The district Medicaid eligibility rate that we call MER, and then what's called the federal financial participation rate. It's around 70%. The feds will reimburse about 70%. So it's basically that 24 million times the statewide RMTS times your Medicaid eligibility rate times that 70% that the feds will reimburse. Now, the things what I want to make sure I point out, the RMTS percentage is a statewide percentage. So all the school districts in Ohio that participate in this program get lumped in this gigantic random moment time study, and therapists are selected, asking them at a specific time on a specific date what you were doing. If it's Medicaid reimbursable, that counts as a reimbursable. If it's not reimbursable, it counts as non-reimbursable. At the end, it generates a percentage. The MER, however, is your district's MER. We take your October count, or we take your student count in October, we run that through Medicaid, and it comes back and says, this percentage of your students are Medicaid eligible. And then the final cost factor, the FFP, that's what the federal government will reimburse you for the program. So cost those 24 million times this RMTS percentage, times your MER rate, times the FFP, and that's what your reimbursement is. Now, we look at those three percentages. Obviously, your cost you can control, but you'd never want to increase costs to get more Medicaid dollars. So your cost you control within your district through budgets and things like that. Those three cost factors we talked about, the first one I want to just single out, the FFP. There's nothing you can do with the FFP. It's a federal percentage. Every state has an FFP percentage. But let's look at MER, the Medicaid eligibility rate. Once again, the Medicaid eligibility rate is the percent of students in your district that have Medicaid insurance. And I'd like to point this out. If we could increase that MER, for every 1% we increase MER, your reimbursement goes up around $61,000.
Just a pause. Page 61, it kind of highlights that so that you can see it on a table.
and is that rate just across the entire population, or across the special ed population, or across the students
We
that are
use
receiving
we use
services?
two
Or is that just a
percentages.
rate for our district?
We use 2 percentages for MER. We have a total population MER, and we have an IEP MER.
Okay,
And it's the IEP MER that has the biggest impact on your reimbursement.
sure.
So what can we do to increase MER? The biggest thing we can do is identify families who qualify for Medicaid but are not actively enrolled in Medicaid and help them enroll. And that would certainly increase your MER. It would also increase the benefits going to that family. I mean, the family that would then qualify for SNAP and for a lot of other benefits too. So it's more than just increasing your MER. But right now, the families who sign up get counted. The families that don't get counted. So that's one way we could increase that MER. Another way we could increase that MER is making sure that our student data is correct, the name is spelled correctly, and their date of birth is correct. Because we send this data to Medicaid, if they spelled the name wrong, it's never going to get a match. We get this data from you, and one of the first things we do is we go through and scrub it for duplicates. And you'd be surprised how many duplicates we find. We're finding now that there's students who are maybe enrolled in Columbus is showing them as a student, and so is Whitehall. So we know that there's some cleanup work that can be done to that database that could potentially increase your MER. So those are the two things that really come across initially that could be done to increase that MER. Your MER has stayed fairly consistent over the years. It's increased a little bit recently. We would expect it would increase more with our economy. But your MER is at 69.47%. So some of your other districts, I think Cleveland regularly is in the mid to upper 70s in MER. So, I don't know if they're working with maybe their county jobs and family services, or they have some fairs going on where they do this, but certainly MER is a way to increase your reimbursement. Now, the other cost factor we talked about is the random moment time study percentage. Once again, this is all the districts in the state. So, we've cleaned up your RMTS reporting very, very much. At one time, we had a few times where we had therapists that wouldn't respond, and if a therapist doesn't respond, it's a 0. Robin has worked real hard that there's no therapists that don't respond. Robin makes everyone respond and stays on them to respond, but we're relying on all those other schools in the state to do it correctly also. And when we look at the RMTS, if you can put page 17 up, it has the RMTS since program inception. And if you look at those first 3 years, our MER was in the 50%. It was as much as 56% at one time. Now it's down to 36%.
That's for the whole state.
Yes, for the whole state. So let me tell you something about MER. For every 1% that we can increase MER, your reimbursement goes up by $103,000. So if we could get MER back to that 56% it was in 2014, that's $2 million more for Columbus City Schools. Even if we increased MER by 10%, that would be $1 million more for Columbus
Dan,
City Schools.
Pardon me. You mean the RMTS?
I'm sorry, RMTS.
Okay,
I'm
thank
sorry, you're
you.
exactly
That
right.
was what-
The RMTS, let me correct myself.
But that would be a statewide effort.
That'd be a statewide.
just
So
make sure I was
what can we do to increase that RMTS? So within Columbus City Schools, we can make sure that all participants fully understand the RMTS process so that their responses are accurate. Because, if a therapist does not know how to answer it, they don't take it seriously and they just say, I'm doing this, this, and this, when really they were doing something reimbursable, but due to their answers, it's showing up as non-reimbursable. That's certainly something we want to correct. And not only for Columbus City Schools, and for Ohio, for every school. That's something that we've lobbied with the state is more training for this, for the RMTS process. We certainly train our therapists, but we're not so sure that other therapists are not being trained properly. So we really push the state to have standardized training to make sure that everyone is being trained to do MER the same way in all districts.
Because this data would suggest that we've gone from 53.20% to 36% across the state, like there's fewer children being serviced. if that's what this rate is, am I?
Well, taking a deep dive, we discovered that depending
mean-
on how the information is reported and how many or the categories that your staff members are listed, if you list staff members that aren't found on the IEP and they are randomly selected to ask what they were doing at that time, and they weren't doing anything that was IEP related, that takes a ding and it reduces the percentage. So our deep dive did discover that there were some folks that were more or less reporting a whole group versus the targeted folks that are on the IEP. And it appears that it's connected, but those are ongoing conversations with the Ohio Department of Education and the Ohio Department of Medicaid that they're investigating.
Yeah, because I would think if I'm those two at the state level, I'm like, well, this doesn't make sense, because that means we weren't falsely reporting at 53%, or we just lost a whole bunch of kids who needed services and they're not getting
We
them.
haven't lost any.
No, I know we haven't, but isn't that what this would suggest?
At first glance, yes.
Okay.
But
There-
they're digging deeper into it.
There's a major issue out there. As a part of what we did, we discovered a major statewide issue.
Did you?
So a few things actually were uncovered as a part of this. And if I can share this with you, as a part of doing this comparison, I was looking at other districts' cost reports, and I found out Cincinnati Public Schools' cost report was incorrect, and they actually got back $1 million more after I advised them to correct their cost report. But anyway,
You know what, I wonder if, I mean, we're taking up a lot of time.
That's okay, this is.
It's really fascinating, well, it's
So if-
fascinating to me because I'm a geek.
and basically, if you look at, so, we originally started seeing, why is this district getting more money than your district when they have less IEP students? And what we went and looked at is, they have more in cost than you too. And that doesn't make sense, but think of this. For you to put the cost on the cost report, that therapist has to be participating in RMTS. So if you put people in RMTS who shouldn't be in RMTS, it'll bring down the state percentage, but I can put all those costs on the cost report.
Okay.
So if I can imagine if Columbus City could put $50 million on the cost report and get 36 reimbursement, is that better than
Better
putting
than
24 million
right.
and getting the 56?
Okay.
So we have some ongoing discussions with ODE and ODM without throwing anyone under the bus, that the RMTS is seriously, there's some issues. So if you look at, some of my other suggestions is make certain that, certainly the Columbus City Schools, RMTS participants provide a measurable amount of IEP services. Because once again, if we put a nurse on RMTS and they never see an IEP student, every time they're time studied, what were you doing? Were you serving an IEP student? No, and it counts as 0.
Okay.
So we need to make sure that what we're doing, that they're providing a measurable amount of services, which they are, you do it right. But once again, we need to look and see that other districts in the state are doing it, especially some of those larger districts that really are going to affect the RMTA percentage. So we've been baffled by why this went down for a long time, and have been asking ODE to do a deep dive and get some statistics. It's a result of the work that we did, that we nailed it.
No, I'm wondering, and I think that I'm in danger of getting us all down more rabbit holes, but it's occurring to me that this might be something that we could consider bringing to OSBA, or, some sort of statewide because we have these conferences.
Well, what I'm doing is working with ODE right now
Okay,
to make it so this can't happen.
okay, well then.
And I'll go on to explain to you what we're doing to make sure it doesn't happen again, and we're going to see that rate go up. But
Hey, Dan.
so we want to make sure that that we're putting the. I'm sorry.
Quick question. So 2 other things I think could also impact that rate. If the number of Medicaid eligible families and students has gone down in the state, that would also affect it. And if the number of school districts that are in the sample have grown, and they've grown in non-Medicaid eligible areas like Dublin, for example, that would also have an impact on this number too over time.
Not RMTS. Now, MR, what we were talking about earlier, but RMTS is strictly, was that therapist providing a Medicaid reimbursable activity
Right,
IEP student.
right, but I'm saying if those districts, for example, in Dublin, Ohio, I would say that the Medicaid-eligible students is probably pretty low,
But Medicaid Medicaid eligibility doesn't have anything to do with it.
but it does on the RMTS calculation.
No.
So but if they call a therapist in
They're two
Dublin,
separate calculations. We have the MER for the district.
Right.
This is a separate calculation. It doesn't matter if the student's Medicaid eligible or not, that RMTS is,
but if the, I'll go down a rabbit hole here too, of statistics, but if they call a district, they call Dublin, Ohio, and a therapist is working with a non-Medicaid student, they'll answer the question, no, I'm not working with the eligible.
no, it doesn't ask you, an IEP student asks you.
On IEP, I meant.
It's asking if you're seeing,
Right.
once again, the program only pays for medical. So the big question is, are you seeing an IEP student? If the answer is no, oh, well, that's not medical, we're not going to. If the answer is yes, then it counts as but Medicaid eligibility doesn't, Medicaid eligibility goes with the student. This is a therapist. This is where we're.
Right, but I guess, and I'll stop at this, but I would say those districts probably would have less IEP-eligible students than would Cleveland, Columbus, and Cincinnati. That's what I'm saying. Probably not saying it's clear, but I think that's the way the math would work.
I would agree that Cleveland would have a lot more IEP students than what a Dublin would.
Okay, thank you.
Yeah. So we need to make sure that everyone's playing on a level playing field. And what we've worked with the state is nursing seems to be the big issue. Because if you look at all the services, OT, they're all serving IEP students. PT, speech, psychologists, they're either testing or seeing IEP students. Nursing students are the one where we have school nurses that handle the cuts and scrapes on the playgrounds and the headaches. Medicaid's not going to pay for that. And then we have the nurses who are seeing IEP students. The problem is the districts that's throwing all their nurses on RMTS. So we're working with ODE, and effective next school year, what we're hoping to get approved is to create a totally different cost pool for nurses.
Done.
So that this manipulation cannot be done, is one thing that we're working on. And then we're working on with the state to have more clear language that tells districts, before you put someone on RMTS, they have to spend a measurable amount of their time serving IEP students. You can't just take a nurse and assign them one screening and then put them on the list. They're going to bring down that percentage every time. And we've done an analysis where we've gotten the data from the contractor UMass who does this RMTS calculation, and we've looked at every service, determined what the percentage is, and nursing is like 5%. A lot of the other services are 60 and 70%. So we've narrowed it down. It is definitely a problem with nursing. So we're working with ODE to close that gap. And what we have to watch is we don't want to put the big spotlight on the program, or we're going to have the auditor state in. And we want to correct. What we want to do is correct it, and then
Structurally.
move on. And
Who's the we who's working with it? Is it you? You say we're working with ODE. Is it we, Columbus City Schools, or
Pardon?
who's the we who's working with ODE?
My firm, the Ohio School Health Services Association. That's an association that Kate King was president of for a while.
Terrific, okay.
We're working with them and ODE. We have not brought ODM into it yet. And we are, Robin and I have talked before how we would love for Columbus to be part of those lobbying efforts too, because we're going to talk about what we're talking about right now. When I say here's potentially a couple $1 million, that's just the tip of the iceberg about what we could be doing, but it's going to take some effort and I'm going to talk about that a little bit later, but there's other opportunities beyond this that could generate some serious dollars for Columbus City Schools. So,
All right. Well, let's hear those other opportunities. I'm trying, to decide if at some point what you're sharing with us, we need to put a pin in it and have a follow-up meeting with, the right people from our organization that might want to team up with you and understand it.
absolutely.
And we're down to our recommendation piece right now, so we'll go over that.
Yeah, well, yeah, I'll turn it.
I mean, it's my own fault, but
Well,
Oh,
and
no, not at all.
I have some more
Great
things to say, but I think I'm
Happy
going to turn it over to Kevin
interested.
for a few more things, and I've got some other even exciting things to talk to you about.
okay, good.
So we've organized the recommendations into a couple different categories. There's a general section, there's an immediate section that can be done right now. There's short range, which can be done in 6 to 12 months, and there's long range that'll take a little beyond, or beyond 12 months. So the first general recommendation is to have dedicated staff charged with coordinating and monitoring Medicaid work for the district and lobbying ODE and ODM for services and funding that other school districts and/or states are receiving. This staff could help to ensure districts' services provided are being documented and submitted to HPS in a timely manner, and that all services provided meet the necessary eligibility for reimbursement. Being the largest school district in Ohio, CCS needs to be an advocate for acquiring the maximum resources for our students to enhance the whole child vision adopted by the district. The recommendation that can be implemented immediately is ensuring that MSP, or the Medicaid Schools Program, reimbursements received by CCS are based on established formulas applied consistently to all school districts. And that's already underway, as Dan talked about with him and the Ohio School Health Services Association meeting with ODE. And now I'll turn it over to Dr. Floyd for some short-range recommendations.
So short range, what we can do is we can communicate with our supervisors to stress the importance for timely responses for the random moment time study emails that they receive from UMass. Right now, I am really highlighting and focusing far more attention on the department that I have responsibility for, but I can make a recommendation to everyone else, but I can't enforce it. Looking at increasing the Medicaid eligibility rate, the MER that we referred to, that goes hand in hand with district communications to sign up for Medicaid insurance. That will help raise our eligibility percentage of those families that are eligible. And there is a misconception of Medicaid and insurance that a certain family isn't billable for this service if the child is on an IEP. They are eligible for Medicaid. So if they have been identified with a disability, they are eligible for Medicaid. Also,
That's true no matter what the disability.
some of the disabilities have a far greater degree of
Right, there's a
specific learning disability, probably not.
Right, okay.
But
That was
some
my
of the
cat.
others, yes, most definitely. Moving forward with the transportation pilot that was halted because of COVID-19, obviously, because there was a bus shortage, or a bus driver shortage, they had to combine routes, therefore there weren't individual routes that we could focus that had only ridership of students with IEPs, but continue working with the transportation department to, when they reestablish those routes to maximize the full potential. So if we just did a pilot for 6 months and 21 buses, and we know we have a much larger fleet district-wide than 21 specialized buses for IEP students, if we expand that, just conservatively, the $250,000 for half of a school year, think about the whole school year, and then think about increased buses. Obviously, I don't have a pure analysis because I don't know the number of buses right now that we would have if we're fully staffed.
Right.
So obviously, moving forward with that. We also mentioned about combining our data. Right now, we have information in IEP Anywhere where they type up the evaluation team report or the IEP, the individualized education plan. That funnels into our Infinite Campus system, which is separate, but it does marry up to some degree. But we also need to make sure that the EMIS data, the October count, that information is funneled in. Also, when we talked about overlapping students and multiple names, sometimes it's human error that they type in the incorrect name. We have a lot of students that have hyphens and apostrophes that kind of create a little kink in the system. So what we are doing right now is we're trying every single quarter to share our data information from Infinite Campus and IEP Anywhere of the caseloads to marry up with the Columbus City Schools ID number to be able to minimize that. But some of the overlaps that we found with students that are in multiple districts throughout the year. Some of them, not all of them, have to do with our students that are foster placed. Sometimes they are in and out of the district. So it is a timing of when we do look at that data and that information. If you're looking at October, and then in May, you're examining and they're in another district, it's like, what's going on? So we're looking at that. We do have Greg, and I'm going to botch his last name, so I apologize, Greg Wisniewski. It's on his list, not on his top priority list, but on the list to look at how we might be able to compile that data. And also kind of focusing on job fairs, getting the information out to families. Perhaps maybe having a kiosk at central enrollment about Medicaid insurance as they enroll into the district. But again, that would be a partnership with Franklin County Jobs and Family Services to reactivate those conversations. So those are a few things that we can do in the short run.
Thank you so much.
And then I got some long-range stuff.
Okay.
So, long range, we continue to lobby state agencies to clean up RMTS, to provide the training they're supposed to be providing, rule clarity, and RMTS rate maximization. There's a couple other things. There's something that's called free care. It's called the free care issue. It was a reversal about 4 years ago, and if Ohio would adapt what the feds will allow them to do, we could remove the requirement that a student be on an IEP to get Medicaid reimbursement. Any plan would do. 504 plans, behavior plans, nursing care plans. The state has dragged their feet on that. ODE is committed to it. Department of Medicaid has dragged their feet some on that. And, but that would, we don't know how much additional money that would generate. But once again, we're talking that RMTS. They wouldn't be asking as a student on an IEP.
The rate would just go up.
So that would bring our RMTS rate up too. So that's something that's in the works. There, I think, are 17 states who have taken advantage of free care, and Ohio has not yet. So we want to lobby for that as soon as possible, especially with the mental health issues that we have that we know are there, and additional ones that are coming. And then there's another service called Medicaid administrative claiming. And this is not therapy-based. This is administrative staff. So administrative staff calls a parent about a medical issue, that's reimbursable. One of your administrative staff works with an outside agency to get someone placed in something medical. So any medical coordination that's being done in your district would be covered by Medicaid administrative claiming. And it's time study based, so it's easy to obtain those dollars. Just about, I would say, over half of the states in the country are doing Medicaid administrative claiming. Ohio has not done it because there's a little bit of things in the guide that need changed to enable Ohio to do it. We're working with ODE for that to happen. We hope to happen every year. We say next school year. And then every year when next school year comes, we say, how about after winter break? So we're still in that mode next school year. But once again, this is where Columbus City Schools could really push this. And that's one thing, me as a billing agent, even the association, they constantly say, I don't want to hear from a billing agent, I want to hear from schools. So Medicaid administrative claiming would bring in substantial dollars. And then there's a couple other services Ohio doesn't do. Delegated nursing, personal care services. Other states do it, Ohio didn't do it. So the new Ohio program started about 12 years ago, and they decided, let's just do the easy stuff first. Let's do the speech, OT, PT, nursing, and psychology. Let's just do that, and then we'll expand on the others. Well, here we are, 12 years later, we have not expanded on that. So to give you an example, the last I looked at this number, Ohio gets about $125 million to their schools for their Medicaid program. The state of Texas that does all these services, they get about $750 million in Medicaid reimbursement. So there's a lot of money being left on the table. And my final comment is in the form of a recommendation that I think Kevin and Robin both have reiterated is you know, that some of these initiatives we've talked about are going to require time and resources within the district. And Dr. Floyd has done a fantastic job managing this program. The progress that she's made with this program and the time that she's been overseeing that is incredible. But Medicaid is just a small part of her job. And, you know, Columbus City Schools has the opportunity to substantially increase Medicaid reimbursement. And I strongly feel having a full-time person to focus on school Medicaid would really help maximize those efforts. So I just wanted to throw that in at the end. And I think in our analysis, that's what we really have all come up with is, wow, there's opportunities out there, and we need, you know, resources to pursue those opportunities.
Thank you. Thank you very much. And thank you for this work, because this is really incredible. And, you know, you have to, you know, talk about, we've been talking about a lot at the board table, getting to root cause. And I think that you all are giving us a good example of some root cause analysis here. And culturally, that's where we want to go as a district, so it's timely in that sense. I think that part of solving this problem, the multifacets of it, there are a lot of silos, a lot of different, depending on which, you know, are we lobbying, are we doing better data keeping, you know, are we getting our systems to talk to each other better and kick out the duplicates or the names that are spelled differently. So I think it seems to me that the next step would be to put some sort, to think about organizationally who to bring to the table, sort of this continuing this interdisciplinary effort to say, what do we do now? What's worth pursuing, what isn't worth pursuing? And that's not for this group. But you've got to start it, and we really appreciate it.
I'm just happy to be able to share out the information, and kind of surprised that all the things that we've been talking about and putting it all together in a format that is reader friendly. We're like, wow, we did a lot of work.
Yeah, that happens sometimes. When you're in the middle of
Yeah,
it,
we
you don't
just
realize it. Right,
naturally
right.
kept asking why, and each time.
And I think what would probably be helpful is if there's some estimate, like you had some estimates of, you know, even if it's just a ballpark of what we could recoup that we're not recouping now, so that there's a real financial reason to do it. Because if you go to page, if you guys are still listening, 42, the one thing that, as one of those CCS providers and that clump of people there, you know, the one thing you don't want to do is just say to everybody at the front line, you know, you have to report better and it's all on you. So, I mean, I think the recommendation to hire someone who's responsible for this is really wise and worth considering. And it seems to me, I don't know exactly what team in terms of the salary would be, but it seems to me there's more on the table than the cost of hiring that person or several of those people from what you're saying. So I think that's the kind of stuff we need to look at going forward. And I can't thank you enough for this report. It's really, and I'm going to spend some more time digging in.
Thank you.
Pleasure. Thank you.
Thank you.
Thanks for your time. We really appreciate it.
Any other thoughts?
No, Kevin, any closing thoughts?
No, I would just like to thank Dr. Floyd and Dan Thomas for all their work. I mean, it's really greatly appreciated. Really educated me into a lot of things that I was interested in, but just didn't know how it worked. So I really appreciate that. Thank you.
I'm excited to have my Friday free tomorrow. They've been taking my Fridays for how long? All day Fridays. We've locked ourselves in we tried to do it virtually and finally realized we just got to get together, you know, face to face, and we pulled it together.
Yep.
It's been fun.
We appreciate it. I mean, this report is so detailed in a way that you can understand it too, which is what I really appreciate, especially the recommendations, because I think once we figure out who that team of individuals is, I think this is a great starting point, and then obviously really breaking out what additional systems are we going to need, because it sounds like there's a lot of technology pieces to this as well, and being able to, you know, we have some tools already, but also thinking about, do we have the right tools, and you know, looking at our technology to be able to capture a lot of the additional data that some of these other programs will require. Thank you.
And very much aligns to our whole child focus. And we want to put clinics in the buildings, and, you know, I mean, like, we can, the synergy can keep building, so that part's nice, too.
And what I always like to emphasize, This is reimbursement for services that you already are providing.
One way or
You're going to
another.
provide it regardless if you get reimbursement or not. So it's not a whole lot of additional work on someone to capture this reimbursement.
Thank you.
Thanks.
Thank you.
Thank you.
Thank you so much.
So with that, we'll move on to the results of the mid-year risk assessment, and that's going to be Mr. O'Connor.
All right, thanks, Carolyn. Just to give you a little highlight of the mid-year risk assessment, our objective for the mid-year risk assessment each year is to identify new, emerging, or lasting risk that should be evaluated within the current fiscal year, rather than waiting until the next risk assessment, because you could have 9 months go by before that.
Kevin, is there a slide that goes along with this, or no?
No.
Okay, okay.
So, I'm sorry, there is a slide in the dashboard, so I'll review that when I get there.
Okay.
Our work included interviews, walkthroughs, and some limited testing based on the risk that we identified. So we identified 7 risks during fiscal year 22 and completed the work in the second half of fiscal year 22. The first one is Board of Education delegation to authorize employment to the superintendent. So previously, employees had to be boarded before they could start. So on March 2nd of 21, the board granted that authority to the superintendent. So what we did is we let that season for a while, and in December, we went in and did a test to see how long it was taking HR to get those people approved by the board, because they still had to be approved by the board. So there were 1,206 employees hired between March 2nd and March 2nd, 21, and December 15th of 2021. All of those were boarded, so there was no issues there. We found that 12% or 139 of those individuals hired took longer than 90 days, which that probably is a little longer than we want. But then we stratified the data by month just to see if there was any trends or anything that might have popped out. We noticed in March, April, and May, the days between hiring and board approval were 83, 66, and 67, respectively. So then we looked at the end of the year we tested, in October, November, and December, and the days between hiring and board approval were 11, 13, and 9, which is fantastic. So once Mr. DeFabo got his staff in place, hired, got the procedures in place, you can definitely see the improvement there that was made. And we passed that along to the superintendent and Mr. DeFabo. So we didn't have any issues there. We just wanted to make sure that the board was aware that that process is working for at least that part of the year. So, risk 2, approximately $44 million of ESSER funds was going to be used for capital improvements, and that is to finish the air conditioning of the rest of the schools. So we looked at those processes to just ensure that the capital improvement staff was aware of the requirements and the documentation that came with those ESSER funds.
Because they're ESSER funds.
Correct.
Okay,
And that's just new to those people.
sure.
So the only thing we noted there is we tested 16 transactions. 12 of those transactions did not have the grant personnel in the workflow. So the way our ERP works in Munis is a supervisor is always in your workflow. So when your electronic documents go there, supervisor approves them, and then they're processed. But normally if it's a grant here in the district, they put grant personnel in there so they can look at that expenditure and ensure that it's an appropriate expenditure, has sufficient documentation moving forward. And if it's not, they can catch it right there.
Sure.
Well, 12 of those 16 did not have that grant personnel in there. So as soon as we brought that to the Director of Capital Improvement's attention, he made sure they were inserted, and going forward, all those also had the grant personnel in there. And again, one of the reasons we did this is for just something like that. If we wouldn't have identified that as a mid-year risk item, you go the whole year without that person in that workflow. So again, that's one of the benefits of doing this mid-year. So we didn't have any other issues with that issue. The third one we have completed is non-public school support, and that is where the Ohio Department of Education funds non-public schools through our district. There was a law change here about a year ago. We weren't really sure what the law change was, but we wanted to meet with the individuals that run the federal and state programs to ensure if there were significant changes, we helped them with their process to make sure the controls were in place and any risk were properly mitigated. The only issue that came out of that is it gave schools an opportunity, non-public schools, an opportunity to opt out and receive direct funding instead of coming through our district. Because of that, the only thing we noted in that audit was in fiscal year 21, or in fiscal year 22, 4 of the 34 opted out. In fiscal year 23, it seems like many more are going to opt out. So,
That's just less paperwork for us, right?
correct, so we didn't have any issues with that. And then the last item that we've completed is just the ESSER funds in general, just looking at the applications, the metrics, some other documentation has to be worked into the applications for those grants internally, and making sure that they were in the application, the metrics were documented appropriately, and we found all that to be good. And that's good, too, because we've been working hand in hand with them throughout the year on that, so.
Does this sound like an example of where the audit team is working almost in real time with the staff to make sure their processes are in order?
Yeah,
Absolutely.
here
Okay, good.
works very
Let's,
closely with
let's,
Catherine and
Yep.
I think the other
Let's
person.
give ourselves, let's stop and acknowledge that that's a positive.
Yeah. So that's the 4 that are done that'll be presented in tonight's dashboard. We have 3 more coming next month. That'll be safety and security, nursing services, and HVAC filter replacement. Those are 3 will be wrapped up.
Okay.
They'll be presented at the June meeting. And that concludes that. I'll be glad to take any questions anyone might have about that process.
Okay, no questions. That brings me to the Office of Internal Audit Annual Audit Plan. So, the work plan is on the screen, and you've also have a copy of it. I would like to start on page 5 of the work plan, because a lot of the other first pages are pretty much what they have been in the past. So the only thing on page 5 that I would like to highlight is the inclusion of the Senior Information System Audit Manager, who was not part of our team last year. You know that Satya Yarmasetti has joined our team and is really making great progress in his work with the IT department. Everything else on page 5 is not new, so I wasn't going to spend much time there. Okay. Next, and I know there might be some areas that Chair Beckerly wants to get back to, but I would like to go to page 17. And this is what starts, this starts the actual jobs that we are planning to do. There's been no changes from the conversation that we had last month as far as the jobs, but I do want to note a couple of possible changes. So the first one is, let's see, the first engagement, special education. We are going to be having a meeting with some of the leadership in special education because we are aware that there is some activity with the Ohio Department of Education that they have been and they are currently working with our team members. We don't want to duplicate those efforts, but right now we're just not sure what that work that ODE is doing, what that looks like. So without knowing what that looks like, we're having a hard time coming up with the scope. So once we have that meeting and we can make sure that we're not duplicating what ODE is doing, we can be much more definitive on what the scope of our work will be. Now, next, let's go to page 18.
Is it, just a quick question, I mean, is it possible that, I guess it all depends, but, you know, maybe there's no need for us to do the audit if we feel like ODE is covering our concern. But, I mean, that's a possibility.
That's a slim possibility.
Yeah.
Okay, got it.
I was like, that's just.
All right, yeah. All right.
I had another note down here. Oh, yes, based on the review of the scope and the work ODE is doing, we'll develop our own scope and update the committee moving forward. Okay. Next, going to page 18. Job 6. Data governance regarding the district goals and guardrails. We are working with the administration to get an understanding of the processes used to input data in the goals and guardrails report that the cabinet and board used in making decisions. This is a very new process for the district, and we don't want to be premature in us going in while they're still developing, you know, their processes. But we do want to be in early enough to get an understanding of those processes so we can make helpful recommendations. I have received a document on how goals, guardrails, and internal audit interact.
Under our SOFG model. Under the SOFG model.
Yes, under the Council of Great City Schools student focus outcomes governance model. I want to consider this document in collaboration with ANA leadership and the superintendent as we develop the best way internal audit can be beneficial and be productive as we, you know, really embrace the goals and the guardrails as a district.
Right, and I think a few things to note here and to share with our community members. I think that what we're talking about is monitoring, auditing the data in the monitoring reports. Is that correct?
Correct.
Right, and so we have to be clear that, you know, that's the data that we're doing in our monitoring reports, which are the leading indicator monitoring reports that we have this 5-year monitoring plan for. And I think that, you know, to be fair, we have to give the administration some time to flesh through what they're doing and how they're generating the data before we go in and start. I mean, there has to be some regularity there and some practice before we decide, you know, whether it's appropriate for us to go in. And what part of what Carolyn's referring to is that with this framework, there's a lot of ancillary things and structures that come with this governance model that we're adopting. And so one of it is the interplay between the Office of Internal Audit and the goals and guardrails, and what's the appropriate function, what isn't the appropriate function. And this is the document that Carolyn's referring to. And it probably would be a good idea to send it to all of you all, because I'd be curious to get your input about what you think, you know, from your perspectives in the community about the balance that the Council of Great City Schools comes up with. So that's kind of where we are on that. And I think that it's a topic that we have to keep on our radar and on our list, but I think we need to be reasonable in giving the administration some time, because what we're finding, I'm going to take a 2-second plug here, is as we're, you know, sorting through, thrashing through these monitoring sessions, they're great TV if you ever want to watch a YouTube video on it. The thought process is changing, and we're seeing refinement between, you know, especially there's a reading report. We've done 2 sessions now monitoring our 3rd grade reading, and the quality of the discussion and the, you know, closer to the root cause, and how do we know the theory of action and the next steps are really tied to the root cause. We're really figuring it out. So it really wouldn't be fair right now to go in and review that data, because we're still in the throes of implementing it. But it's kind of encouraging, the mindset change that I think we're starting to see.
Right, and we want to have, you know, the conversation with Dr. Brown, who puts together a lot of this information, and we haven't done any of that. So that's why I'm saying, you know, we don't want to be premature in trying to come up with a scope with a process that we just don't know enough about right now. But it is definitely important, because it is information that the cabinet and the board uses in their evaluation. So,
And ultimately, once we're up and running, like a well-oiled machine on this, it's very appropriate for the board to know that we can count on because of, normal audit. I mean, I keep getting back to this idea that we want to get to the point where we're doing cycle audits just as a matter of course and not just auditing things as they percolate up, right? So periodically kicking the tires on the data is an appropriate audit function when we're up and running with the process. So, it belongs there, just maybe not quite yet in terms of being active.
All right, so the last thing that I have on that was that at a later date after, me and my team kind of combed through this document, I'll share the document with the committee because I would like to get your
Yeah,
feedback.
I think that's a good idea. I'd be curious.
Has there been any discussion from like the board members, what like the general risks and concerns would be regarding to that? So if we're asking Auditor Smith to audit against, right, and controls, I guess, what are the risks and the what can go wrongs relating to generating, right, the KPIs and things like that?
Okay, I either want to ask you to say it again, or can I say what I think you're saying? Because what I keep thinking is we want to look at our risk analysis through the lens of our goals and guardrails. Is that what you're getting at, or something different?
Well, more so related to, as we're generating these KPIs, what can go wrong, right? Which are areas that concern you as the board that can go wrong out of these KPIs? So what are potential risks? Like, is it data accuracy? Is it, right, that the calculations are incorrect, or is there other risks, right, that could
Process of
potentially
generating the data.
there's that, right, or other things that can go wrong, right? So and it's more like a spirited, open discussion, right? That what do we think are the plausible scenarios that can cause inaccuracies, right, or any other things that can transpire, right, causing data to be either wrong, incorrect, right, whether accidentally or purposely, right?
Okay. Which is a little different than what can go wrong in terms of not getting to your goal. You're talking about what can go wrong in terms of trying to get a clear picture on where you are.
Yes. So like in information security, we employ, like as we evaluate specific scenarios of systems, there's often discussions where you evaluate which things can go wrong, whether to like impact one of the three things, right? Whether it's, we call them as CII triad, like completeness, right, of the data, or like confidentiality of the systems, right? So that just may be something to consider, right?
Okay.
Because that could help Auditor Smith, that if the board is asking her to evaluate this, right, could help with determining which audit procedures, right, they want to perform, right? Because it's like, if it's like KPIs, right, and accuracy, right, depending how the data is generated, that could be one set of procedures, right? Or is it like some other risks that we want to look against? That could be a different set of procedures to perform, right, by the IA team.
Yeah, I think this document does mention the KPIs, and like I said, I wanted to have a little bit more time to really read through it. But that is once we understand the process, we might have recommendations as far as maybe considering a different source to get something,
Yep.
Like
But
bad
once
management
again,
kind of.
I want to sit down with the management team and understand the process, and then we can be better able to make recommendations.
But Elia, it sounds like you're suggesting that the board should be clear about what it's asking.
Well, not necessarily clear, but you would think about risks or major concerns, right, that you guys could think of, right, in addition to maybe the audit team could think of, right?
Okay.
Hey, how can this, if the KPIs are truly going to drive the board
They have to be
decisioning,
right.
right?
Yeah.
Well, which thing can impact, right, the accuracy or completeness of the KPIs,
Okay.
right? It could be anything simple from, like, if we're using Excel to generate the KPIs, do we need to evaluate those spreadsheets and make sure that they're accurate, right? Because what is it, like 89% of all Excel spreadsheets used in finance have some kind of error in them, right?
Okay.
You don't want to discover down the path that, oh, wow, this calculation was wrong for the last 3 quarters, right? And then looking procedures around how that's generated, right? So,
Okay.
And not for this engagement, but we did do something very similar with a consult that we did in transportation when we found a lot of reliance on Excel. And pretty much the same thing that you're getting at. It wasn't as accurate as, it needed to be for them to be making decisions on.
And I threw out 89%. That
Oh,
dates
good.
back to my audit days. And Mr. Jordan, you probably know better, right? But that reliance, it's just even something simple like that, right? And I'm not saying you're using Excel, but
I'm just saying, but no, but we have ran into situations where, something would be put into an Excel spreadsheet, and then it will be put into another system.
Oh, it doesn't get picked up.
And there were data issues with that transfer of information because of the way it was going from the Excel spreadsheet into
More things to worry about.
the transportation system, and then a similar situation with another. So, yes, that is one of the things that we want to get an understanding of the inputs and what systems they're using to input that information that's being used in the monitoring reports. So we have not had those conversations with management yet.
and Chair Berkeley didn't mean to generate any concerns, but the point is, having a discussion like that then can be useful in generating audit procedures that could disprove that type of risk, right, or concern. So
Well, and it also sounds like, being involved now as the data is getting generated might be constructive to our team because we may alert them to some things or some practices or triangulating data or, validating it that might help avoid that risk. And
Yep.
if we're saying hands off and let them figure it out, when we might be able to help them figure it out better up front, that's important.
Yeah, I think it's right. I think you first get back to what's the metric we want to calculate, and how do we all agree it should be calculated? Take, for example, days of attendance in school. And then once we all agree to what the calculation is, and is the data correct? So is each school in the district calculating it correctly? Are we counting sick days or virtual days all right? So is the data correct? And then is the math right? So is the numerator and denominator correct? And again, I agree that there's lots of errors that we find in spreadsheets all the time.
Really?
Yep.
Yeah. Well, I mean, I have my own little thought that's coming out with this. I was really lucky enough to attend a completion ceremony for a group of special ed students that were in their 5th year. And they were doing embedded life skills at the Hilton over at Easton. And many of them were actually getting employed there. It was just a really beautiful morning. But in terms of the data that's right, there's tension in how we calculate graduation rates. And so those 8 kids get counted as, an extra year back at the high school they're allocated to. And that might be true for state purposes, and we can't change that. But for calculating our graduation rates on our goals and guardrails, I have a note to myself to try to circle back and see if we can figure that out, because the last thing we want is disincentivize our principals to recommend kids for this program, because it was all joy. And they've got the capacity to increase. So, it seems to me that's part of what's hovering about here. That would be
Yep.
Right.
not entirely the same thing, but the same.
Well, but it is, right? Oftentimes you see when metrics are generated that they drive unintended consequences.
Exactly. And that conversation should be probably constantly happening.
Yeah, and that's something that Auditor Smith and the team can take and generate audit procedures to check for that, prove or disprove, right?
Okay.
I was just going to say, I think the
Really-
part is that you may have to build some of that into your guardrails. So rather than try to scrub it and not have it in there, just understand that, hey, these are things that are going to, maybe, whether it be a 4-year graduation and, it's a 5-year or something to consider, when you're building up your data and what your expectation as to when you need to act. Because your guardrails is really just saying, hey, this is something I need to look at. And so if you build that expectation into that, then, it's already been accounted for.
Address it.
Yep.
Yeah.
Okay. Thank you. Thank you, thank you.
Let's see if I have anything else on this. Just my normal, as usual, this is a plan and is subject to change based on the facts and circumstances and emerging and changing risk faced by the district. And also in accordance with IIA standards, any changes to the work plan will be submitted to the committee for deliberations and approval. So I'm happy to take any questions on the work plan before I ask for the work plan to be recommended for adoption by the Board of Education at their second meeting in June.
I was telling Carolyn before the meeting started that I thought she did an excellent job with this presentation. So I was asking who was the targeted audience for this. I just think it's really, really well done.
Thank you.
I agree, Mr. Grant. It's come a long way. I think back since 2015 to where we are today. It's great to see. Just a couple thoughts for consideration. One on number 5, just unfortunately given current events that have taken place, I might suggest that once the school year is up and going next year, should you participate or observe a lockdown drill to make sure it's functioning as the district wants it to, and actually participate in a handful of different schools, both elementary, middle school, and high school, just to make sure it's doing what you want it in the time frame that you want it to be taking place in. And lastly, just a consideration, and I know Satya's on the phone, just under number 12, I would add that along with user access, think about attack and penetration at your various egress points that could take place, remote computing, remote printing, just various areas, vendors that have access to your system, and then the extent that you may have some thoughts around data loss prevention. Can folks take data off the system, HIPAA data, other types of student information that might be important that, is that data hardened from access to be, basically, I'll say the word stolen from the district. So that, other than that, I think it was well thought out. It's a good plan.
Thank you.
Yeah. Thank you, Mr. Jordan, for saying that, because that has been, unfortunately, a topic of conversation the past 24, 48 hours. And not just because of that. I mean, we've been seeing that for weeks and years, and it's really unfortunate that we are still dealing with situations of having to prepare for, the unexpected in that way. So I appreciate you saying that. And I know, Madam Auditor, we kind of briefly talked offline, just in terms of the goals and the guardrails, really wanting to see just additional ways to highlight and connect our priority areas to those goals and guardrails. And so I really appreciate the report. I felt like I understood, the recommendations. I understand that there's also, additional conversations that still have to happen in order for us to really assess, the areas that have been identified. And so I just, I would be curious, after those conversations have happened, like, for example, related to special education services, once that meeting has happened, will we then get an update as to what the scope of work will look like after you receive that information? I guess for me, I want to understand, we've identified these areas, obviously more conversations and meetings need to happen. What is then the reporting process back to the committee, or even, thinking about the next steps? How does that information then get shared with the collective?
Normally, this is an outline, so it's not going to be specifically what we're going to be doing. The more detailed document normally is going to be the dashboard.
Okay.
So once we have that conversation, I won't bring this back for, another vote by the committee. But we'll work on the scope of the audit. And if I think there's a need to get some additional input, I will do that. But normally you won't see it again until it hits on the dashboard as far as the upcoming engagement. And at that point in time, we actually have like a date of when we're planning on starting, what phase we're in. Are we in the planning phase? Are we in the, so there will be more of an opportunity for input at that point.
Okay.
It won't, like I said, this won't come back again until next year.
Okay. Makes sense. Thank you.
All right, I want to do my little circling back to the goals and guardrails. On page 8, when you listed the risk is identified as a potential loss due to, I want to see something in there, and I don't know if it's appropriate, and that's why I would want to look to our community members as well, because I might just be a little bit uber focused on goals and guardrails, but like, should there be like a bullet that says, you know, risk of not achieving our 5-year strategic goals and guardrails? Because, and maybe I'm being too laser-like focused on one hand. On the other hand, it seems like we're trying to, well, it doesn't seem like we are trying to change culture. And I feel like we have to be consistent, you know, in our negotiation strategy, in our audit strategy. And I don't know if that's an oddball thing to do. Like, would normally you add a failure to achieve your strategic plan in
Well, I think
a
it's
risk?
I think it's in that last bullet, but it certainly
It is, it's
wouldn't
just
be
not
bad to call it out if you really wanted it to be
Call it out specifically?
right there, sure. But I think.
Okay, good. I
think
was
the last
hoping
one
you would
covers
say
it.
that. All right.
I viewed it as being in the last bullet, but we can be more specific as far as, instead of saying the,
I would really appreciate it, at least until we feel like this is ingrained in our DNA. And along those lines, when I looked at pages 9 and 10 with the audit units, and we talked about this a little beforehand, but I wouldn't mind hearing from our outside experts whether, again, I'm being overly focused. Not changing any of this other than to maybe add an asterisk or add some sort of highlighting that reflects those things that are a little bit more, that are risks that are more, not aligned, because that's not aligned, risks that are more likely to impact our ability to achieve the goals and guardrails. Like, for example, if you look at equity, there's whole child supports, and one of our guardrails is we shall not neglect the whole child, or language to that effect. So that would be one that, to me, is highlighted as, you know, critical path to achieving the goals and guardrails. That's a unit area, an audit unit that we need to maybe pay a little extra attention on to. And is that an inappropriate thing or unusual, or I'm trying to slice the baby, not slice the bologna, sorry, I'm not slicing any babies. Too thin or too, you know, too much, or, you know, lay off, Carol, this is a perfectly fine report. I'm just curious. Judging by the silence, I think maybe I'm going too far.
No, I just think you're talking things about that are maybe more a little global. It's almost getting back to your mission, you know, type level. You know.
Yes.
So, I mean, I guess you stay on mission if you accomplish your specific objectives. So, but I know what you're saying. You know, do you need to spell that out to say, hey, I want to make sure this is front and center. You know,
That's exactly
this is the
what
key
I'm
thing
saying.
that we're trying to
And
achieve.
again, maybe during the transition to a different mindset, making sure we're all really uber focusing on it. And then I just don't know if I'm being too picky.
Yeah, I mean, you want to see the trees, but you also want to see the forest.
Right.
Yeah, well, one thing you could consider is what's a horizontal risk that covers multiple units, and maybe one of the horizontal risks is not achieving our strategic long-term objectives. And so you could call out which units that affects, then that might change your cadence of how often you look at them too, and the level of risk.
That's what I'm trying to get at. Is you know, slightly changing, not hugely, but slightly changing what percolates to the top, based on this new mindset.
Yep.
Okay, so it's not a. Well, then let's talk about that some more. Then, and I don't.
yeah, because I would need to know really what that's going to look like, because one of the things that we were really mindful of, and I keep coming back to why we added talent acquisition, you know, to the audit is because of some key personnel losses that we know. And we know without those key people in place, it's going to be difficult to achieve the
Goals and the
goals, the guardrails surrounding, you know, the whole child support.
Yeah, that's what I mean. I'm not so sure that, I think that probably you are considering it in identifying these risks, and I just would love to see some sort of a highlight so that during this phase of trying to change culture, we're really all, we're just talking about it incessantly, I guess.
Okay, we'll give it a try.
Yeah,
I think we can do it.
Maybe you flag it on the plan.
Or just a foot, or like an asterisk,
Yeah,
these things are decided.
we'll come up with something and then, but my main concern is the work plan, the jobs that, I'm recommending that we do.
Yeah.
Is that acceptable to go forward to the board?
Yes. Oh, yeah. Yeah.
Okay.
And my thoughts are, I think she's adequately addressing it here. I guess we can nickel and dime things to some extent. I can appreciate what you're saying.
Right.
Because you want to make sure it's explicit, but I think how the order has it mapped out here is beyond appropriate.
Yeah, oh, yeah, okay, fair enough. And then maybe say it a different way. When we go before the board, when you go before the board, they're gonna ask that question. And so if we don't have it inherent in the report, that should be something you're ready to talk about in terms of, these are the reason why we picked this 8, because they're on the critical path to.
I think we can do that.
That's not the right
I
word.
think,
Why can't I find the right words? They're the ones that are most impactful, or, what's the language I'm looking for that says they're the highest risks to impeding our ability to get to the goals and guardrails? I can't, it's awkward language. Anyway,
I think we get where you're going.
okay, good.
And the other part is, I don't know that just the marching orders that internal audit is doing is strictly all your goals and guardrail.
Right.
This is
Oh, no,
part of it.
no, there's more than that. Yes, no, I think that's true. That's why it's just like a slight elevation, because the other stuff is absolutely important too.
But you're looking at it from the standpoint of how does the board want to kind of consume this so that they can understand, exactly what are key areas that they need to focus on.
And I love how this was put together. I mean, I couldn't agree more. It was easy to consume. It made sense. It was really, I think, a wonderful report. So I don't mean to be suggesting that at all. I'm just on the.
oh, no, I definitely, I know what you're saying, and we're just trying to figure out how to get it in here and get it.
And Carolyn, it may be that you take some of them and just group them into certain categories and say, this is how this affects the strategic goal as it relates to the goals and guardrails. So you take a couple of the areas and maybe we're kind of grouping them up into larger.
I mean, I was even thinking just an asterisk and a footnote that says these 6 out of the however many are considered, most impactful of our ability to achieve the goals and guardrails or something like that. And not like just that little bit of a thing, but you were.
Is there a more holistic effort, like, as we think about, within the school district, how everybody contributes to the, like, goals and guardrails?
That's what we're trying to get at, is
Right.
everybody understanding how they contribute to the goals and guardrails. That's exactly right.
Right, so I guess at that point, I would ask, is the audit unit as comprehensive as we can get it, right? Because if we know that to a certain extent, everybody from, early childhood education to then even the custodial services contributes to the golden guardrails, then it is, right, just maybe which areas we focus on that comes out of the risk assessment, right? So
highlighting one doesn't make sense because the assumption is everything does.
well, I would expect that the school district doesn't put money and effort into things that won't contribute to goals and guardrails. At that point, I would ask, is the audit universe comprehensive, right?
Okay. That maybe then in the back of my mind, that was hovering a little bit, and that's why I was trying to tease this out. So we're sending an interesting message if we identify some and not others.
And not to go into a story, but at one point, I had a friend that interviewed in cybersecurity in a children's hospital, and one of the things that impressed him was that even a cybersecurity team within that children's hospital, they knew exactly how what they do contributes to the hospital's mission, which is, like, obviously paraphrasing, but helping children in needs, right? That need health services. So maybe that's a thing to consider. Like, does every department, like within the school district, understand how what they do, right? Because even if somebody in accounting, right, they're not educating students, but they perform a critical function as it pertains to funding the school district, right, and making sure that there's enough dollars for what the board wants to achieve, right?
Well, and then, but this is where I get wrapped around the axle in this thought process, because that is true, and I think we can take every function and decide, to your point, they know how they're contributing to our ultimate goal, on the one hand. On the other hand, to affect change, and based on these 4 disciplines of execution, you have to somehow manage what they refer to as the whirlwind, however important it is, the day-to-day stuff, in order to land the plane. And if we don't learn how to focus on landing the plane, we're going to continue doing what we've always done, is manage the whirlwind and never grow. And I don't know where that, so
But that's,
am I trying to do it through the wrong vehicle by saying, put a footnote here? And that may be true based on Ilya's point, but that's kind of what I'm wrestling with.
and that was the challenge that I was having, was, if we show,
Don't
okay,
elevate one thing over another.
these,
Yeah.
these, are, everything, we did the risk analysis, we did the screening process, and these items were the ones that percolated up to the top. But if we, like I say, I keep coming back to that talent acquisition, because originally that was not something that was there until recent events kind of elevated that.
But the goals, recent events elevated that, and they would have elevated that regardless of whether we had the
Correct.
goals or guardrails. So that's.
Yep, but you look at even the discussion we had at the beginning of this meeting, if we had a more focused, right, audit plan, would we not enable a chief auditor to ask the questions that she asked, right? Which ultimately identified that there's opportunities here for additional financial funds to be recovered based on the programs we already provide to our students, right? And so I think the balance is finding that, enabling Auditor Smith to do what she does best, right? And having a certain, I think, amount of freedom within the program, right? And the audit universe that comes out of the risk assessment, right? So yes, you want to focus in certain areas, but then also in certain areas you want to just see what the risk assessment spits out, and let's look at that, right?
And I guess, and maybe this is where, maybe it's all solved just by adding that bullet on page 8, because maybe if we define that as, then by definition, your impact analysis includes that. And maybe we're done.
Yep.
That might make more sense. Okay,
Because there was one, and I'll
thank
talk
you.
to
Thank you for indulging me. I really do appreciate thinking through this.
No, I think it's important, right? And the goals of guardrails are important.
That, that might just be it.
That concludes my report. I guess I do need a vote if I can, like I
Okay.
said, the main thing that I'm really, needing to take to the board are the actual jobs that we're planning on doing, which would be pages 17. I'll take the whole thing, but the main focus
Sure.
for me is 17 through 20. Knowing that as events happen, something could percolate to the top, and I would have to bring that to the committee to adjust the plan. But at least we would like to have something to start with.
Yeah.
And I
Start
guess,
with a plan and execute to the managed plan, right? So that's what the managed plan is what we land on at the end of the year, so.
and then I guess the one thing with number 6, how is that going to be presented in terms of, we're giving them, the staff, some time to sort through the process, and perhaps in the meantime, we'll look at,
And we'll still be spending time, doing it. It might not be an actual audit, it will.
might be
probably
more of the
yeah.
kinds of things
So there
that,
still will be time
Ilya was
spent
talking
on this,
okay.
getting, that understanding and looking at the data that's being used. But it might not be, it probably won't be ready for us to actually do some type of engagement before the monitoring reports, because they're still working on what those monitoring reports look like.
Right. So it's sort of like, how do you audit a moving target like that?
Yeah.
Okay. I just think that we need to be very clear about what we say and don't say, so we don't cause undue concern among those that are trying to figure this out for the first time.
Correct.
Right.
Okay.
Okay.
You call for a vote for the work plan?
Oh, vote. Okay, yes, sorry. I'm sorry. So can I have a motion to present this annual audit plan to the full board?
So moved.
Okay, without objection, shall we agree that we will send this plan to the full board? All right,
I'm sorry, who was the second?
I'll second it.
Okay, thank you.
thanks, Tim.
Just a question, do you need to add that one bullet that Carolyn's talking
Yeah,
about?
that edit.
Yes, I'm going to change that. I'm going to emphasize that bullet includes the goals and the guardrail. I'll be specific in that language.
Perfect. Thank you.
Yeah, I have that down here on page 8, bullet 5. Yes. Okay, last but not least, hopefully we have time for the internal audit dashboard.
Yes.
report. Mr. O'Connor?
Yes, this will be quick.
Okay,
We'll go with page 3, we'll start there. And again, you can see that data governance job is in blue, which is planning, which we've had a lot of discussions about the goals and guardrails and what our intentions are and how to best do that. So we never got out of the planning stage so far, so I'll probably be bringing something to you in June to let you know what we've done and to close that out. And then we'll open the next one for next year. Position control in the planning phase. The issue there is we had the budget director of the district leave employment with the district. He went somewhere else. So that was a combination of HR and budget, both working on position control. So we have worked with HR, but I'm not sure that's going to get off the ground either because we haven't looped in Terry Addison, who replaced Scott Gooding. So, but I'll give you an update on that in June. One thing to note, there are some yellows there that have an R in them, which is the report stage. To just let you know, those are progressing. So you don't see all this yellow and say, what's going on? Those are actually in the draft report stage.
okay.
Just working through that, so those will be presented in June. And then there's an MR, management request. When we got into capital improvements to try and do their follow-up, they had asked us if we could put that off till June because they were busy with some other things, and we had no problem with that. So just so you know, that one, that's why that one's still in the yellow stage. Page 4, that's just a recap of what I discussed earlier in the meeting. You'll see the 4 in green, which we discussed, and then those 3 will be coming in June. Similar discussion. No additions, deletions, adjustments to the plan this month. Then on page 7, we have just an update on outstanding recommendations. Again, the first page, number 7 there is implemented, not verified by risk rating. So again, to recap, those are recommendations that have been submitted to our office by the process owner, asking for us to review those and validate that those have been successfully resolved. Page 8 is in progress. That's a listing of all the audit jobs, or all the recommendations still currently with the process owner, and they're working on resolving those recommendations. Page 9 is external audit recommendations. Only change there is we put on the fiscal year 21 auditor of state. We had 2 recommendations that went on there, and those are currently open. And then page 11 is just activity for the current month, the different professional development activities we took part in. The one real good one was under Association of Certified Fraud Examiners, the 21st Annual Emerging Trends Fraud Conference. Very good information there. Had some very good speakers, too. If you're familiar with Theranos, and it was a company that was put out, I think it was up in the Stanford area, big major fraud with health machines that were going to monitor your blood and tell you things, and it was all fraudulent.
Right, the
They
whole
had the
thing.
whistleblower at that conference.
Oh, no
So to
kidding.
just hear the things that she went through and she saw and how she did what she should do, take it right up the chain, and it just wasn't believed. But to hear that story was phenomenal.
I was gonna say, Kevin, every time I hear a fraud presentation, I want to change my, what I work in.
For
It's like,
sure.
I don't want to do this anymore.
Page 12 is just the advising and consulting, and there you'll see the school Medicaid program. That'll come off after our presentation earlier today.
Terrific.
And then page 14, again, is just an update. We did put on the fiscal year 2023 budget number that was approved by the board. So that's the only change to that page. And that concludes my report. I'm glad to take any questions anybody might have. All righty, thank you.
Thank you.
That concludes my report.
Thank you. All right. I think that if there's nothing else, this meeting can adjourn without objection. Without exception or objection. Thank you all so very much. It's a pleasure.